Pneumonia in children is part of the diseases referred to in pediatrics as acute respiratory infection, which is the #1 cause of mortality all over the world and the third greatest cause of children's death in Nigeria. There are so many misconceptions about pneumonia in children and so many wrong steps, so many wrong things parents do when children have pneumonia. And that is what we'll be unraveling today. By pneumonia, what do we mean? Pneumonia refers to inflammation of the lungs as a result of infective pathogens, as a result of germs, so to say. And these germs could be viruses, bacteria, and very rarely fungi. The common misconception about pneumonia is that pneumonia is caused by cold. That when a child is exposed to cold, I'm talking by cold, I mean environmentally cold temperature, that the child will develop pneumonia. And this is often a cause of the children being overwrapped. Pneumonia has nothing to do with the environmental temperature, basically. It's due to germs that entered the body, often from the nasal passage. That means it is something, these germs are breathed into the lungs from the environment. And so the pneumonia disease usually will start commonly with temperature, cough, catarrh for about a day or 2 or 3, and then the child, it will descend down from the upper respiratory tract into the lungs. And the usual presentation of pneumonia is a child with fever who is breathing fast. That kind of a thing. Is breathing fast with temperature. And when this happens, what the public needs to be told is that any child with pneumonia is about quarter to danger. By danger, I mean the possibility of dying, because whenever the child begins to breathe fast, it means that oxygen delivery into the body is compromised. And you see a child that is breathing fast is already announcing that, look, there is a problem with my lungs. I can't breathe properly. I can't get in enough oxygen. Pneumonia is one condition where the parents are not advised to try any remedy on their own. That child should be taken and rushed down to the hospital immediately, because at the hospital, the first thing that the doctors will usually do is to augment the breathing with oxygen, such that whatever little air that is able to get to the lung has very, very high amount of oxygen. That is an emergency measure to keep the child alive, while the doctors usually will get a vessel, will set a line, so to say, like a drip, and then from which drugs will be delivered to clear the infection very quickly. What I'm saying in essence is that whenever a child has temperature and is breathing fast, the temperature may not be very, very high, but so long as the child is breathing fast, that child should be rushed to hospital. Pneumonia is not the only reason why children will breathe fast, but whenever there is fever and the child is breathing fast, the child should be has a high risk of having pneumonia, amongst other acute respiratory infections. The other common situation where children will be breathing fast, with or without fever, it could be asthma, it could be croup, it could be what we call laryngotracheal bronchitis, otherwise called croup. It could be laryngitis, and it could be very, very, even more dangerously, epiglottitis. When that one is the case, there's usually some noisy breathing. Apart from breathing fast, there will be some um, a characteristic noise, and it is rapidly fatal because the airway could just clamp closed, and when that happens, it is very fatal. There will usually not be time enough to rush the patient to hospital to have care. That is why the message for parents and caregivers of children is that children with fever who are breathing fast, even if they do not have obvious fever, the next 10 minutes, the child should be in a hospital being evaluated by doctors to rescue the child. The thing about pneumonia is that it is very, very, very easy to treat. No child need die of pneumonia in this present age of knowledge and availability of competent manpower. Once pneumonia is adequately treated, usually in less than 5 days, the child is usually fully recovered, and then the patient can go home. Sometimes, with the right treatment, even in 48 hours, the condition has been controlled, and the patient may be discharged home. The closing emphasis is that pneumonia is not caused by environmental cold temperature. If cold temperature were to be the cause of pneumonia, should there be any child in Canada, Russia, that don't have pneumonia? These are traditional superstitions which are very, very widespread in the Nigerian society. But you are informed. I believe that your child or anyone around you will not be a victim of pneumonia death. I'm Dr. Blessing Okperi, consultant pediatrician at the South Shore Women's and Children's Hospital, Victoria Island, Lagos.